The Big Trip. The Big Trip.
Some people who have PTSD, it's a single event. It's a single firefight, and that's what they have nightmares about each and every night. But sometimes there is no single incident you can point to because you're always under threat.
In 2006, U.S. Army Sergeant John Lubecki was stationed in Iraq at an airbase that was bombed so often it was nicknamed Mortaritaville. His PTSD symptoms started the week he came back home.
I'd wake up hearing explosions that weren't there. I would hear like helicopters that weren't there. A few times I had full-blown flashbacks like I was back in Iraq.
John struggled for 8 years to find a treatment that would give him some relief. More than once, he tried to kill himself. And then this happened.
An intern from the Medical University of South Carolina was filling in for my psychiatrist. And I'll never forget, she slid a piece of paper across the desk and said, "Look at that after you leave. I'm not supposed to tell you about it." So as soon as I walk out of the hospital, I open it up and it says, "Google PTSD MDMA." And so I did.
MDMA is better known as ecstasy, and that tip put John in touch with MAPS, a nonprofit organization that funds psychedelic drug research in Canada and the U.S. In 2014, John became a participant in a clinical trial for MDMA-enhanced psychotherapy.
It's like doing therapy while being hugged by everyone who loves you in a bathtub full of puppies licking your face. When I went through other talk therapies or CBT or things like that, whenever I got anywhere remotely close to what was truly the trauma causing me issues, my adrenaline would kick in and my fight or flight response kicks in. And with the MDMA, I didn't get that adrenaline kick. The hairs in the back of my neck didn't stand up. That entire physiological reaction to the trauma was disconnected. So I could actually just talk about it.
John is not alone in benefiting from the study. According to MAPS, almost 70% of the participants were still PTSD-free a year after being treated with MDMA. This fall, MAPS is starting phase 3 trials with patients in Canada and the U.S. in collaboration with Health Canada and the FDA. If all goes according to plan, MDMA will be a legal prescription drug by 2021. And that might just be the beginning. We're launching our new season here at Day 6 with The Big Trip, a special series about the research that's transforming psychedelics from Technicolor party drugs,
greatest gift to mankind since Tutti Frutti ice cream,
to potentially revolutionary treatment tools.
This may indeed become the next big thing in psychiatry.
I cannot tell you how big an impact it is on your life.
Around the world, researchers are testing psychedelics on everything from addiction to treatment-resistant depression. The results are still preliminary. Sample sizes have been small, but many of the trials show success rates above 60%, with effects that can last for months after the patients have taken a single dose of the drugs. In some cases, a single dose of psilocybin seems to be enough to help patients kick their cigarette habit. And new studies just keep on coming. This week, a team at the Imperial College London launched the first ever placebo-controlled study of LSD microdosing, and now investors are taking note.
If this is a really important new movement in mental health care, there can be various ways of monetizing around that.
With the rush to capitalize on legal marijuana, some investors are looking past pot to psychedelics. Mendel Kaelen is among the first entrepreneurs looking at that new market. Mendel is a neuroscientist. He spent years researching psychedelic drugs at the Imperial College London, but earlier this year he left academia to start WavePaths, a company that uses technology to create soundtracks that will help people have better psychedelic trips. Mendel, good morning. Welcome to Day 6.
Good morning. Thanks for having me.
For a lot of people listening, psychedelic therapy sounds either like a party or a nightmare. If someone signs up for this, what are they in for?
Well, they're in for a therapeutic experience and a meaningful change in their personal lives. At least when we're speaking about psychedelic therapy, the main purpose of that experience or that these sessions is to take a psychedelic compound in a controlled environment under supervision of trained psychotherapists with a specially designed music playlist to have an experience that has both acute and sustained effects on your mental health and well-being. So it's a very different environment than when you would take it on in a party environment or in any kind of environment that has a lot of unpredictable variables in there, meaning the experience will also be quite different from those other environments.
But is the experience itself disorienting? Is it in any way, is it alarming?
Some patients indeed experience some forms of disorientation or anxiety, but these experiences were transient. And especially when it takes place in a clinical environment, when you have supervision of psychotherapists who know that experience really well and know how to help you navigate that experience, any form of psychological discomfort that can happen is either transient or can actually be a doorway to meaningful therapeutic changes that can occur or need to occur.
Your team at Imperial College London studied psilocybin, which is the active ingredient in magic mushrooms, as a potential treatment for severe depression. What did you learn about how effective it is?
What we observed was that patients show an acute response, so depression goes down immediately after administration of the drug in most cases. And more interestingly, we see a sustained effect of this. We see a sustained reduction in depression for the weeks and the months after this treatment as well. So this is one of the things that myself and all the other colleagues in this field find so fascinating, is that we can here administer a drug once or maybe a few times, but observe both an acute and an effect that sustains beyond that experience, beyond that treatment session.
There are instances of depression that are also resistant to traditional SSRIs and other pharmaceuticals that are available now in psychiatry. Did you treat any of these people with psilocybin, and what did you observe?
Yeah, all of the patients in this study had the diagnosis of treatment-resistant depression. Some of these patients were depressed for 15 years, some of them were depressed for 35 years. So really quite an amount of suffering that these individuals went through in their lives. They tried a lot of different modalities that didn't work for them.
And that included psychiatric drugs?
Exactly. That included psychiatric drugs, different forms of antidepressants, or different forms of psychological treatments as well.
Right.
Overall, around 1/3 of all patients do not respond to any treatment currently available on the market. So there's a really strong need for better, more efficient, more effective treatments.
So let's look at the scientific integrity of your study, because these studies are notoriously hard to blind. People tend to know when they've been given a psychedelic drug and they're tripping. How can you be sure that the results that you just explained are not a placebo?
Yeah, that's a really, really good question. I mean, every single patient knows that he or she had the drug or not. One of the ways to control for that is by having different types of placebo conditions. So that can be either an active placebo condition, how we call it, where the patient receives a different compound that has still some psychoactive effect. The other way is to simply compare this treatment with other psychiatric medication as well. But in addition to that, there's also, of course, something to say for a placebo effect. There's a huge potential in our thinking, in our minds, that is strongly intertwined with our sense of self and our well-being and our mental health that is still really poorly understood as well. So I actually think that the placebo effect is not something that should be dismissed, but it's something that we actually should aim to understand.
More than 500,000 people in Canada alone are suffering from treatment-resistant depression. So that's a huge potential demand for these drugs should these trials prove their efficacy.
Yeah.
How closely is the pharmaceutical industry following the studies that you and others have done?
I think the amount of for-profit organizations that are currently entering this field range between 5 or 10. But then there are also movements that I may not necessarily be aware of, because there are a range of different elements here that you could consider profitable. One is the creation of the compound itself, psilocybin in this case, or other compounds such as LSD. Some of these compounds may not be necessarily patentable anymore, but some still are. And on top of that, there's also a possibility to design compounds that are new, are different, but have similar effects and have a similar molecular structure, so to speak. So there's a range of opportunities there, and these opportunities are clearly manifested by this interest from industry that we are observing at the moment.
Because I heard that Peter Thiel, the billionaire investor, has put millions into a for-profit company to produce pharmaceutical-grade psilocybin. What does that tell you about where the industry might be headed?
Right. So, I mean, I don't know the details about the negotiations between Peter Thiel and the respective company, of course, but I think that the least we can say is that this is a sign that this is moving beyond the academic community, and that some really serious investment communities are indeed recognizing that there is an opportunity for something to grow and become profitable on quite a large scale.
So maybe not the drugs themselves, but the supervision, the controlled administration of those drugs, that part of the therapy is another another potential area for growth. And you have a financial stake in that. Your company, WavePaths, has created an app that could improve people's psychedelic experience through music. Who do you imagine your customers would be?
So we have two different business models here at play. One is the relationships we are building with institutions that are doing psychedelic therapy and are also able to provide psychedelic therapy legally in the future. So in that case, we are helping these organizations with the design of physical environments in which these therapies take place, and also with the help of providing the adequate music playlists for these sessions. WavePaths was really born out of my own research with David Nutt and Robin Garth-Harris and Amanda Fielding at Imperial College London, where we studied the brain mechanisms involved in the actions of psychedelics. And in my case, specifically, we looked at the effects of music in interaction with psychedelics. So again, psychedelic-assisted psychotherapy is a package. It involves the administration of the drug in a safe and specially designed environment. And then for the 4 to 6 hours that follow, patients listen to music, very often with eye shades to focus the attention inwards. And what we discovered in this research is that music plays an incredibly important role, both in influencing the experience during the therapeutic session, but also, interesting enough, in predicting some of the sustained improvements that we see in patients. So really out of that, together with the realization and the observation that more and more clinical trials are starting with these compounds, there is a need to work effectively with music. So what we are trying to do with WavePaths is really to support the patients and also really to improve treatment efficacy.
Mendel, prescription MDMA could be available in Canada by 2021. What do you think the odds are that 15 years from now, we will be trading psychedelic stocks alongside marijuana stocks on Canadian stock exchanges?
I think it's a very realistic scenario for that to happen in the future, where you look at the incredible amount of individuals who need a better treatment and the paths that we're currently walking to make these treatments available. That is a very likely scenario. And also because cannabis is primarily used recreationally at the moment, it operates on that market, so to speak. The healthcare market is a whole new level. We're talking about the treatment of treatment-resistant depression, post-traumatic stress disorder, smoking cessation, anxiety. We'll need to see where research is bringing us, but if things go ahead the way it goes right now, that is a very likely and interesting scenario.
Mendel Kaelen, great to talk to you. Thank you for being with us.
Really a pleasure. Thank you so much for having me.
Mendel Kaelen is a former neuroscientist with the Imperial College London and the CEO of the psychedelic-inspired startup WavePaths. That's it for part 1 of our series. Next week, your brain on LSD.
More flexibility, more openness, being more open to experience. That looked a lot like what we were seeing in our studies of children.
How psychedelic drugs could help us cope with mental illness by leaving our adult minds behind. That's next week on our special series, The Big Trip.
The Big Trip.